Hello everybody. Today we are going to talk about seasonal affective disorder. This is something that comes up amongst my family members, co-workers, and definitely our clients. So what is seasonal affective disorder? Also known as SAD. Seasonal affective disorder is a type of depression that is related to seasonal changes. They typically worsen in the winter when you have decreased sunlight hours. This lack of sunlight causes decreased serotonin levels, decreased melatonin levels, and reduced vitamin D levels, just to name a few. Some symptoms include the seasonality of SAD. It tends to increase and worsen in the autumn and improve in the spring. Again, this is associated with the reduction in sunlight hours in the autumn and winter months and an increase in sunlight hours in the spring and summer months. It's associated with fatigue, moodiness, feelings of listlessness, sadness, or lack of interest in doing activities you typically would enjoy. Maybe you have difficulties falling asleep, you're sleeping too much, sleeping too little, or just not feeling rested. You might have increased carbohydrate cravings with possible overeating and even weight gain. You can also have difficulty with concentration. SAD is also associated with increased illnesses in the winter months, and this again is due to a decreased sun exposure, decreased ultraviolet radiation exposure on surfaces, which we'll talk about, and dry conditions that can lead to issues with your mucous membranes. During the autumn and winter months, we have decreased sun exposure. This means less vitamin D production in your body, and vitamin D is a very important antioxidant that helps boost the immune system. Decreased ultraviolet radiation from the sun also is an issue because this ultraviolet radiation helps kill bacteria and viruses on surfaces. Now, in the winter months, we tend to congregate in more closed spaces. Obviously, there's more colds and flus, so we have breathing, we have coughing, we have sneezing, we're in close quarters, and now we don't have the sun's ultraviolet radiation on surfaces killing those same germs. And so we need to consider an increased frequency of cleaning on those surfaces, so especially those that are frequently touched. Your cell phone, keyboards, maybe your desk, any place that would get high traffic would be a place to consider cleansing more frequently. Also, washing your hands is very good hygiene, as we all know. In regards to our mucous membranes, the colder temperatures of the year do tend to be some of the driest times of the year, even if there's snow on the ground. Now, these drier conditions can cause our mucous membranes, like in our nose, to dry and crack, and that damages them, and that reduces their optimal functionality as a physical barrier to both virus and bacteria. So one way to combat this is to use a humidifier in your home or your workspace. Here are 7 tips to prevent illnesses and seasonal affective disorder. We want to increase our natural light exposure whenever possible. But if that is not a possibility for you, there are other options, including wide spectrum lights that can mimic the sun and still give us a similar response. So in one way or another, we need to increase our light exposure. Exercise. Exercise is important for our mood and our immune system as well. Regular activity can help us regulate our hormones, it can improve our energy levels and our endurance in general. What we eat matters. Most packaged foods are devoid of important micronutrients. Your body needs these micronutrients to improve or to optimally perform and fight illness. We should limit our sugary foods, increase our protein, our healthy fats, and try to overall maintain a healthy diet. This includes eating more fruits and vegetables. Try to eat the rainbow of colors, including the dark greens, the reds, the oranges. Eating high quality fruits and vegetables will give your body the needed minerals and vitamins it needs for the micronutrients, the phytochemicals, and the antioxidants to fight pathogens. The benefits of consuming fruits and vegetables include they boost your immune system, they improve your energy levels, they ensure your body processes are functionally appropriately, so if you are exposed to bacteria or virus and other pathogens, it's ready to handle that exposure. Stay hydrated. The human body is primarily made of water, which is critical for all body functions. We can best is to stay hydrated by drinking water. Try to avoid beverages that contain artificial sweeteners or chemicals, or as I like to say, anything that I can't spell or pronounce is probably not something I should be eating or drinking. We want to stay hydrated both internally and externally. That means use the humidifier. Keep your mucous membranes from drying out and losing their optimum ability as a physical barrier to pathogens. Sleep. We do need to make sure we get adequate amounts of sleep. Yes, sometimes SAD can lead to increased sleep, but is it restful sleep? Part of getting good sleep means good sun exposure or good light exposure. Artificial lights do not count. We need to make sure we keep our normal body rhythms as best we can, and so good exposure of sunlight during the day will help you sleep better at night. Wash your hands. This is a good idea any time of year, but particularly in the wintertime when we do have more contact with others and we already have decreased radiation or ultraviolet radiation exposure and sunlight exposure. Touching your face is one of the quickest ways to expose your body to pathogens. We want to wash our hands to limit that touch from a surface to your face where you can have virus and bacteria enter your body through your eyes and nose and your mouth. But also just try to avoid touching your face as much. It's amazing how many times we do that during the day. As I've said before, we want to spend time outside every day if possible, or at least under an artificial light source that is full spectrum that can help boost our immune system and keep our normal biorhythms in check. We want to eat a well-balanced diet and exercise daily. Consider supplementing, maybe vitamin D, vitamin C, B vitamins for your energy. These are things that you should talk to your provider about and see if that's something that would work for you. Stay involved. Keep involved with your friendships and your support groups and your volunteer activities. And if you're feeling depressed and fatigued or irritable, make sure you consult your physician or your provider for recommendations on how to address these feelings. Thank you. I appreciate your time on this topic today.